Opioids were responsible for a quarter of the deaths among Canadians in their 20s and 30s in 2021. That grim toll coming from researchers at the University of Toronto. Fatal overdoses among young adults were highest in the prairie provinces, increasing fivefold in Manitoba alone. Overall, opioid deaths doubled between 2019 and 2021 to a total of 6,200 across the country. The team involved says the surge coincided with pandemic health measures that saw reduced access to harm reduction programs. Joining me now is Shaleesa Ledlie, co-author of the study and a PhD candidate at the University of Toronto. Shaleesa, thank you very much for joining us today.
Good morning.
These are some frightening numbers from this study. Where did these numbers come about, and what made you decide to take a look at this?
Yeah, so these really rising rates of opioid deaths is something we've been talking about for almost a decade now across Canada. But this is something we really saw starting to escalate even further throughout the COVID-19 pandemic. And, this is something that touches all demographics of people, but we know that often people are quite young when they die. So tragically, their lives are being very cut short due to opioid overdoses. So we wanted to do this study to really try to summarize this impact across Canada.
And any indication as to why we've seen this surge?
Yeah, so, often when we see these rising rates, it's very directly tied to changes in the unregulated drug supply. So we've seen now across many regions in Canada these shifts to where the unregulated supply is almost entirely composed of fentanyl and fentanyl analogs. And this is resulting in situations where it's very difficult for people to now actually know what's in the substances they're using and what's the dose that they're taking. And based on this, it's just very hard to adjust your dose accordingly.
What can we do to try and lower these deaths?
I think it's just more critical than ever that we have an approach that's a combination of different treatment and harm reduction options, right? I think it's clear that there's not a single solution to this crisis. So we need to continue investing in evidence-based treatment and different harm reduction approaches, things like safer opioid supply programs, supervised consumption sites, and even just more widespread education and distribution of naloxone.
Now, there has been some controversy with safe injection sites. Are they working?
Yes, we have evidence based out of Ontario that in the communities where these sites are implemented, the rates of overdoses do decline in these communities. So I think it's really important, when we talk about the politics of these issues, that we try to focus on what the evidence tells us and to make sure that we're not speaking on misinformation.
And are we talking a lot of money to try and get to bring about changes and drop this number? Because what percentage of deaths is that for young Canadians, 20 and 30 somethings?
It's about 1 in every 4 deaths across all of Canada. And, when we looked specifically at Ontario in 2021, was as high as 1 in every 3 deaths. So I think it just shows how devastating of an impact this is really having.
Okay.